After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com. Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series Video on Demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing.
Hey, everybody. Welcome to Ageless Health live stream with yours truly. Here, we just finished up on WMAL 105.9, and hopefully you transitioned over and you're here with me. But just remember that all these programs are available to you. All you have to do is go to drtomroselle.com and go to the podcast section and go to the live stream section, and you can sit there for a long time going through a lot of data. Let me know what you like about the programs, and let me know what it is that you'd like to know more about. I want to remind you, coming up January the 22nd, 2025, and I was mistaken on WML. I gave the wrong date. I apologize. But at 6 p.m. at the Roselle Center for Healing in Fairfax, Dr. Harlan Browning and I, the professor, will be presenting an evening on your feet and basically, how it affects your entire health, your skeletal health, everything from your top of your head all the way down to your feet, from your feet all the way down the top of your head, and what symptoms can come about from that you may not have thought about that started in your feet. And in today's live stream, we're going to get into a little bit more of that and talk about what, in fact, you can do to help yourself. It's going through 2025. We're going to talk about your feet, and we're going to talk about, your overall health and signs and symptoms of, if you will, that really are important not to ignore. So let's get into it just a little bit. And we spoke about your feet and the loss of sensation. We talked about your feet being cold all the time, just like your hands. It could be a Raynaud's problem. We talked about cracking and fissuring. We talked about ulcerations and sores that just don't go away. We talked about your big toe throbbing, and could be something called gout, and how do you know if that is, and so forth. How about the discoloration of your toenails? How about if there was a line going straight through your big toe, particularly, what would that indicate? What would that mean? And when I told you that it may be a sign of something very deadly called a melanoma, I had a couple people write very quickly say, "What? How's that the case?" Well, it is the fact that could be what it is. So let's walk into this a little bit by kind of doing the end first, by simply saying your symptoms most likely will generally indicate something that is benign. And I don't want to scare you. I just want you to be aware. But you got to keep a good eye on your feet, because it can give you a look at the rest of your health. And if you really know what you're looking at, if you really understand what your feet are telling you, wouldn't it be great then, to be able to take action before it got to the place where it's going to cost you, and perhaps a lot more than you're willing? I've talked in previous programs that if you look at your feet, and even from the knee down, right? You look at your feet from the knee down. If there's what looks like a shininess, a little bit of swelling, like it wants to crack and bleed if you touched it, that's a diabetic sign, and you can't ignore it. At that point, you're pretty much down in the well of a real bad situation, and you want to make sure that you resolve it as quickly as you possibly can. But there's other indicators. What happens if the heel, I'm using my hand to show you, what happens if your heel is cracked and it's fissured and it's crusty and so forth? It could be a lot of things. It could be diabetic, but it also could be a straight up indicator that your thyroid is not working the way it's supposed to. And it may show there before it shows anyplace else. So wouldn't it be important when you go to your doctor's office and you're complaining about some of these things, that they take a look at your feet as well? What happens when your toes, your nails, start lifting and they start cracking, they get thick, and they start peeling like phyllo dough? What would that suggest? That may suggest that you have what? Fungus. And if you have fungus, you got it all over your body, not there. That's the end product of a metabolic position, meaning that your blood is sweet, so to speak, and you can grow those things so nicely. You basically have mushrooms in your toes. I'm using some kind of provocative terms there to get your attention, but really that's what the deal is. So if that's the case, don't you want to do something about it? Don't you want to shift and change things as we go through? I would think so. I know I would. I do. Anytime I see something that in my body that shouldn't be there. But at the end of the day, you can't ignore this stuff. If you have diabetes, if you are in even the pre-diabetic state and you say, oh, that's not too bad, and you see a little blister or an ulceration, and no matter what you do, it doesn't go away, that's an end-stage diabetic pattern that may cost you that toe, may cost you that foot at some point. It may turn into a gangrenous problem if the infection becomes unresolvable. So don't you think it's time that you do something about it, that you shift, you change, you make a difference? I think I would. As we get into the program today, at the end, I'm going to give you 5 steps for 2025 that can make a huge difference if you just do some gentle changes in shifting and so forth. And we're talking about this, a fungal infection. What does it mean to have a fungal infection? Many of us think it's just because we were athletes and we had rashes underneath the arms and in our genitals and so forth. And that went along with the deal. Or in our feet, we had athletes' feet. That's where the term came from. Well, basically, they're euphemisms, right? That just means you got a fungus infection. But you don't have a fungus infection if you have taken care of your health, that you kept the sugars out of your body, you keep the fast-acting carbohydrates out of your diet, you're not putting tons of dairy products in your diet and so forth, and you're keeping your health in a relatively good place. And that means, yes, you got to dry your feet well, and that means that if you're in a shower area with you have a cracked foot or an injury on your foot or whatever, that maybe flip-flops might be a really good idea. And then using a non-chemical powder to keep your feet dry and so forth. All of those things will help. But the most common signs of a fungal infection on your feet is going to be itching and peeling. Yes, it can be treated by, putting an antifungal cream on it and so forth. But you have to take the steps of prevention first. Now, if you're fungus-free and you still have those symptoms, you might be dealing with an eczema problem or psoriasis. Well, there's ways of making that determination, but just remember that eczema and psoriatic problems are generally due to dietary patterns and liver and intestinal tract function. So we're still back into the same thing. We set the stage for so many of these things to occur. And it's not necessary that you go on these heavy-duty biologicals to suppress it, because it's suppressing your entire immunological reaction within your body. But it's important that you treat it properly. And because if you don't treat it the way it's supposed to be treated, it continues to persist. You just suppress it in one area, but it's still there, and it's causing your immune system to break down. Now, on the 22nd of January, coming up, a couple of days left in this old year of 2024, at the Roselle Center for Healing in Fairfax, 6 p.m., we're going to get into a lot of this. Dr. Bynum will talk to you about the problems with your spine. I'm going to talk to you a little bit about your feet and your spine and your head and your body and the predisposition to other conditions. I'm going to tell you some of the signs and symptoms that you need to take a look at that are straight up, and how you differentiate. We're going to talk about the differentiation pattern. We're going to talk about that hypothyroid presentation. I will. And we're going to talk about diabetes and how it presents. And we're going to show you some of these things. Dehydration and nutritional deficiencies can be as problematic to your feet, causing foot cramping. Your toes just want to do this. You can't straighten them out. It can be that, that calf cramping in the middle of the night wakes you up in the middle of the night. That is usually a very easy resolved situation. The first thing you got to do is start with water. If you're listening to the radio program in WBL 105.9 just prior to Asia's Health Livestream right now, what you heard me say is I encourage my patients to start their day with a glass of filtered water and put about 1/8 of a teaspoon of Celtic salt in it. Why Celtic salt? Why do you hear me keep saying Celtic salt? Celtic salt is the most clean of all the salts, but it also has the highest amounts of trace minerals. It actually has about 74 trace minerals that your body needs. And for a lot of patients, I have them use a little salt, little salt, little salt all day long, just to make sure that their body maintains itself. But, you may want to realize that without calcium, without magnesium, without potassium, without psyllium, without, the list goes on with the minerals, that your body can't function normally. And you end up with a lot of these symptoms, if you will, including circulatory problems and nerve damage, that if they go too long, they become a problem, and it's called permanency. You've damaged the nerves to the point where they don't resolve anymore. So we have to make sure that we understand what our toes are trying to tell us and what our feet are trying to tell us. And let's just kind of walk through a couple things so you understand what actually is presenting. So your cold feet, let's talk about cold feet. Everybody's got cold feet, and it's like, well, there's sometimes guys, right? You got to put your socks on at night, but women generally, that could be a tendency towards peripheral artery disease, or something they call PAD. Everybody likes initials these days, so PAD. So peripheral arterial disease has some familial finger pointing. If your mom's got them, you're probably going to have them, and so forth and so on. Not necessarily, but possibly. But they also have to do with things like diabetes. And if you're a smoker, it's cutting the circulatory effect off to the extremities, not only your feet and your toes, but your fingers as well. And if those fingers, they're numb across the board, it could be the neck, it could be the cranial nerves, but it also could very commonly be circulatory pattern. Again, we call those Raynaud's. Now, in the office, through our affiliate company called Thermography Centers of Fairfax and Thermography Centers of Virginia, we do thermographic imaging that is very specific and tells us whether or not that circulatory pattern is becoming impaired. It's the best diagnostic, as far as I'm concerned, in my opinion, that you can do to identify circulatory problematic situations. So, that's one of the things that we would, if we have a patient that walks in like that, we're going to suggest and refer them to our affiliate company, and to get that done a whole lot better than doing, peripheral testing with needles, a whole lot better than doing x-rays, a whole lot better than doing a whole lot of other things, because it really tells you immediately whether there's a problem there. So if we got a Raynaud's, if we have a peripheral arterial occlusion of some sort, we've got to find out whether or not it's there, number one. Number two, we're being effective in treating it. What happens if you have burning pain? Okay, we talked a little bit of that peripheral artery disease, that PAD situation. Is it one side or is it both sides? Generally both sides. And it's an inflammatory reaction due to something. It could be part of that athlete's foot problem, because then it's got into the neurological bed and it's causing a problem. What happens if your feet are swollen? You got these big dogs on there and they shouldn't be there, right? So it could be gout. It could be cellulitis, which is a very painful, can be an infected pattern. It could be a breakdown in the joint space as well, due to other disease process called Charcot tooth joint disease. It could be a possible thrombosis within the vein. Remember I said in the first part of the program, when you go to the doctor, you complain about a problem in your foot. Does your doctor take two fingers, and let's say this is your ankle. We'll pretend this is the ankle, right? This is your foot. Right here in this area, there's a pulse, an artery. It's called the dorsalis pedis pulse, and pedis meaning foot. So does he take fingers, or does she take her fingers and just gently palpate that to see if, in fact, they can feel the pulse? My guess is on an occasion, if they're really astute practitioners and they really know how to look at the body, they're looking at your toenails, they're looking at the dorsalis pedis pulse, they're looking at the skin surface, they're comparing one side to the other, they're using a pinwheel, if you will, or even a pin to find out if you've lost sensation, where you've lost sensation, testing the muscles of the foot, looking at the way you walk, putting you on a platform that will measure the weight bearing on one side or the other. There's a lot of different ways of making this happen. So then do you look at the toenail coloration? We talked a little bit about that, right? And it's commonly, in people who are athletes, and they have a lot of, if you will, moisture in their foot. And psoriasis will show up that way, and anemic patterns will show up that way. So you have all of these things, but here's the other piece. Immunosuppressive drugs, like all the garbage that they have on the market right now with all these vaccines, one of the presentations can be problems showing up in your toenails, but also in your fingertips and your nails of your hands. but chemotherapy. And as we talked about, that melanoma and so forth. So when your toes look kind of funky, there are many different things, if you will, that are causing that. And you have to make sure that you understand what it is and that you take action accordingly. You know, sores that don't heal in a reasonable period of time are finger points that you got to do something about it. You got to do something about it now. You can't wait. You can't put it off. Well, let me see if it goes away. Got to go to somebody who knows what they're looking at, but not just take this and, you know, let's see what happens over a period of time. You got to identify it. You really have to get it. You know, we look at structural components of the body from your feet, from your toes, all the way up to your nose. And we want to find out how they're interrelated. What are the signs and symptoms that show up? And then more importantly, if it's neurological, how do we treat it? If it's an energetic problem, what does that mean? If it's a vascular situation, can we treat that by supporting your system, by doing different things? And we have a host of things that should be used, everything from laser therapies to right frequency current machines, to acupuncture, to dietary changes, to making sure that the structural system of the body is working properly. You have to apply the right fix. You can't just throw a drug at it and say, let's see what happens, because then you're suppressing something else within the body and you can make it worse. How many of you have been on multiple rounds of antibiotics over a period of years? If the answer is yes, the chances of you coming up with mold or fungus conditions anywhere in your body, but particularly your feet, are going to be significant. That's another reason that people are predisposed to fungal toenails and so forth and other places in their body, because they've been taking all this junk and they've been exposed to it, and they put it in our foods and they inject our animals with steroids and antibiotics and so forth. And, you know, you heard me in the first part of the program, and I was talking to my cousin up in Toronto, and we were saying, you know, we go to our father's homeland in Sicily and we can eat food there that we can't eat here without symptoms, without feeling lousy, without feeling bad. Because if you look at the boxes, if you look at the labels and so forth, it looks like a chemistry set, and you're putting that in your body. That's not what food is. That's not how you're supposed to be nourished. You know, years ago, people didn't have the conditions that we have now. People weren't overly fat like they are today. You know, think about it. You know, if you're in my generation, go back to when you were in high school and look at some of the pictures of your friends. And did you see many people that were, you know, overweight? Did you see people who were over, you know, fat, if you will? Not like today. And we have a lifestyle that is detrimental to so much of what we do. If you get a weight-bearing problem, you know, your feet are okay until you stand up, right? Once you stand up, your feet feel like hell. Well, you could have a stress fracture in there, yes. And you have to, why does that happen? Why does a stress fracture take place? Because we're not putting the right mineralization in your body. We're not eating well. Our stomach acids are really low. That's not what's causing your burning, by the way. It's the other way around. It's the alkalinity is way too high. That can cause burning just as well. So we don't have enough, you know, mineralization in our system. B12 might be low in the body. So now when we start using muscles, the fascia tightens down. But if there's not enough B12, fascia is going to pull too tight. Yes, B12 and folate relate to fascial function as well. So we could have spinal stenosis, our low back, anywhere in our low back. If the canal, the hole that the nerve comes out of is being crushed like that, it's going down your legs, it's going down your feet. So when you stand up, it's going to feel worse. Not a good thing. So we have to understand there are multiple pieces to this puzzle. And sometimes you can fix things by stretching the feet. You can fix it by adding the right nutrient bases. You can fix it by putting the right type of weight-bearing orthotic in. And that has to be measured, not sitting on your feet. You can do all of those things to make a difference. But if it is a destruction of the neurological bed or the spinal system, or if it's a diabetic situation, or there's a chemosuppressive or an autoimmune suppressive condition, the body tells you what they are. We know that we can identify a hypothyroid condition by looking at the feet and looking at the cracking and fissuring. Look at the peeling. We can look at a diabetic. We can look at some cancers. We can look at peripheral arterial disease if you examine it properly. If you don't, you got a problem. And you have to make sure you understand what the signs and symptoms are. And that's what we're going to do on the 22nd here at the Roselle Center for Healing in Fairfax, 6 p.m. Dr. Harlan Brown and I are going to kind of tag team again, and we're going to have some fun. But, you know, I'm always in awe, if you will, of this man. He's brilliant. He's unbelievable. He knows his structural components when it comes to the feet and the knees and the hips and the back and the spine, probably better than most people ever will. So join us. I'm the guy that's going to throw in all the other pieces. And if you've been to the classes, you know that we get pretty in depth in some of these things. But we do these programs to educate you, to make sure that you have the knowledge, the ability to say, hey, doc, don't you think we ought to check this? You know, hey, doc, you know, what's going on here? And ask the right questions and ask about the right lab work and so forth and so on. That's why we do these classes. So mark your calendars, the 22nd of January. Better yet, call right now. You know, you go online, go to rosellecare.com. Okay, ROSELLECARE.com, rosellecare.com, and go down until you see the, you know, the picture that noticed the ad for the class. Click it, register now. And only one favor that I ask for you is simply this. What I want you to do is make sure that if you can't be there with us, please cancel. Try to do it at least a day before. And because otherwise somebody that wanted to come that needs the information is not going to be able to get it. So the next and my last gift to you for today is really simple. I want to give you some steps to take care of yourself in 2025. All right. Understand that 2024 is gone. It's memory. It's in the archives. But in that year, even if we've had some things that were struggles, there were some good things that took place. Celebrate those little things. Celebrate the big things. Keep them in the front of you. When you set your intentions, you know, New Year's Eve, everybody comes up and they're going to do, you know, they're going to set all these things that they're going to do. Well, what I want you to do is I kind of want you to reframe them. Give yourself 3 primary commitments to yourself that you're going to make strong for what? For 2025 and the rest of your life. And here's how you do it, okay? It's not a resolution. That's kind of weak. Resolutions last about a month. Maybe, if you're lucky, maybe 6 weeks. Some people get really, really lucky and they last longer. But a commitment is simply this, is cutting off any other options. So decide what those 3 things are, that if you really worked on those 3 things continually, and by the way, don't think you're going to be perfect off the mark, but you're going to focus on it. Here's the key. Why do you want to commit to these 3 things? If the why is big enough, you're going to get it done. Somehow you'll figure it out. You're going to get it done, right? So set your attention, not just make it a resolution. And then every little piece along the way that you achieve, celebrate it. Give yourself a pat on the back. Don't go out and drink a bottle of whatever and go to, the cake shop and get a whole bunch. No, celebrate it in a way that continues to support that process, and then get an accountability partner, actually partners. Get people involved. Tell them what your commitment is, and ask them to hold you responsible, to help you stay solid on your commitment. Somebody that's going to give you crap, somebody that's going to make you feel really embarrassed, that you don't want to fail in front of them. And then what you want to do is you want to understand that there are people out there who've done what you've done. Mirror it. Find out what they did, how they did it, what their state of mind was when they did it, and mirror them. But continue to move forward. Don't drop it off. There's an intentional situation in a commitment, whatever you declare that is. But if you say, for example, and I use this often with patients and doctors, you say, listen, I want to become, and by the way, this is how you do when you want to lose 30 pounds. Let's say, and I'm making these numbers up. Let's say you're 220 and you want to get down to 190, or you're 180, you want to get down to 150. Don't say, I want to lose 30 pounds. Say, I want to be 150 pounds. I want that to be, and define it. I want that as a woman, you may want it to be 23, 24% body fat. As a guy, you may want it down to about 16% body fat, 17% body fat if you're older. All right. Now you've set components to that. You want to be able to wear a certain size. You want to have energy, and define what that energy means. So you're working towards a positive outcome. Because if you lose the 30 pounds, let's say you're really successful, you drop that 30 pounds with drugs and all these people that are out there promoting the drugs and this and that and the other thing, and you get there, now you say, now what? So it's always, it has to be, what is somebody who weighs 150 pounds? What do they do ongoingly? What is their life like that keeps them at that place? How do they continue to tweak it to make it better and stronger moving forward? It's that and more. But if you have opposition, a counter action, you lost 5 pounds and you go out and have a hamburger and fries and a milkshake, I think that's probably not really commitment, is it? So you want to make sure you do that. So celebrate your progress, make sure that you do the things you do, and exchange, if you will, the attitude of I can't to one of I can and I will. It could be a great year if you make a decision. Join us on the 22nd of January. You know me. If you need to ask anything at any time, all you have to do is go to either drtomroselle.com, send me a note. I promise you I'll respond to you, or go to rosellecare.com and send me a note that way. One way or the other, I promise you I'll get back to you. But in the meantime, make those commitments to yourself. Think about them. Don't do them last minute. And then start putting that game plan together. But think about why you want them and make sure that you do it ongoingly. What I want for this coming year is I want greater health for everybody that I can influence and touch and help them along their journey, to serve you, to educate you, to empower you along your path. Remember one thing. I love you all. See you next week. Bye. Take care.